As a neurosurgeon, one of the most common patients that I care for is a traumatic brain injury patient. And when people hear that diagnosis, traumatic brain injury, they often think of the athlete or the soldier or the car accident. But the reality is that the most common traumatic brain injury patient is the older adult over age 65. Here's why traumatic brain injuries can be more dangerous in older adults. Let me start by explaining what a traumatic brain injury, or TBI, is. A traumatic brain injury is a consequence of an external blow to the head that affects how the brain works. Sometimes a traumatic brain injury can induce a short-term, short-lived problem. We can see a broad range of symptoms. It can be headache, double vision, confusion, fatigue, memory change. But in other circumstances, it can be really quite serious and even lead to death. No two traumatic brain injuries are alike. There are many reasons why older adults are now at greatest risk for suffering a traumatic brain injury in the United States. But it's really just simple falls, like going up a flight of stairs, going out to get the mail, that can lead to the unintended consequence of falling and hitting your head. It is estimated that 1 in 4 older adults in the United States fall each year. And we see this because as we age, our balance is affected. We're not quite as agile as when we were younger. And on top of that, the older adult population in the United States is very frequently on medications like blood thinners. These blood thinners, while they can be very helpful for your heart or lower your risk of stroke, if you fall and hit your head while on blood thinners, you're much more likely to sustain a bleed inside of your skull. Another fact of life as we age is that our brain atrophies or shrinks just a little bit. One of the really important things that we want you to understand is that, especially for the older adult, where there's a little extra space inside the skull, if you fall and hit your head, it may take longer for that space to fill up with blood, and so you may see the real serious problems arise in a delayed fashion. That makes us even more concerned because a problem can be brewing inside of your head that can lead to a very serious situation and you don't even know it. So even though you may feel okay, it's important to seek medical attention to ensure that there isn't a very serious problem that's brewing inside of your skull, because it's a lot easier for us to help you before the problem becomes serious. We want to make sure that every older adult in America gets the message. Falling and hitting your head can be very dangerous. For more on brain health, visit AARP's Brain Health Resource Center at www.aarp.org/brainhealth.